Hi, my name is Mallory, and I researched eating disorders in the adolescent population. So, some background information: the textbook definition for this class of an eating disorder is on the screen there for you to read. I'd like to also start off by saying that the etiologies for an eating disorder, especially in a young child, could span wide and could be anything. Um, they can include eating patterns of the parents, hereditary traits, the school environment, sports, social media, and in America, eating disorders in adolescents affect 7% of boys and 13% of adolescent girls in the adolescent age group of 9 to 14. And the etiologies can span wide because adolescent age children are influenced by everything around them and can mimic their parents, their siblings, anyone. So I'm going to first talk about etiologies, and in the hereditary category, it means that genes can be passed down that can further lead to an eating disorder. And some of these genes can include impulsivity, obsessive thinking, perfectionistic tendencies, and sensitivity towards reward and punishment. And like I said before, children mimic their parents and anyone around them, so family eating patterns are a huge one. If the mother is restricting her calories, a lot of times the daughters can do the same thing. If the parents are not eating what's on the table, like vegetables or healthy starches, the kids will do exactly the same thing, like not finishing their plate. And the textbook also stated that the pattern of coercing a child to eat a defined amount of food can start a pattern of disordered eating. The etiology of the school environment, it can severely impact the school performance of a young child, specifically lack of focus, temperament issues, and a weakened immune system. And the weakened immune system can further lead to the child not being in the classroom as much because of getting sick. So that right there I have the behavioral, physical, and emotional signs of an adolescent with an eating disorder. And while you read them, I'd also like to go over that damage from an eating disorder in young age children can include a weakened response in the brain regions that are part of the reward circuitry, a shrinking in the overall size of the brain, and an adverse effect on the emotional centers of the brain. So the etiology of sports is very important in a young child, especially with the influence of social media and everything. So the sports that young children can play that have a high percent of eating disorders are gymnastics, ballet, figure skating, wrestling, and cheerleading. Risk factors for an adolescent getting an eating disorder and playing sports are having a coach that focuses primarily only on success, the child being an elite athlete since playing the sport since extremely young, if they play an individual sport rather than a team sport, and if they have performance anxiety. A very well-known source stated that it can be difficult to distinguish athletic eating from disordered eating patterns. And a lot of sources stated that BMI is not a good measurement for diagnosing a adolescent or a young adult with an eating disorder because it does not take into account muscle mass. And I believe that programs that they are detecting for injuries all the time, that they should be implementing things to detect and screen for eating disorders. Another thing that can happen with young girls who are athletes is that they can develop the female athlete triad, and that is an umbrella term for the young woman having osteoporosis, amenorrhea, and patterns of disordered eating. And during the female athlete triad, they can have a lot of missed periods or never get their first period. And to finish up the etiology part, sexual abuse can also be the beginning stages of an eating disorder. A source stated that children who reported sexual abuse are 2.5 to 5 times more likely to become bulimic. So these are the three types of eating disorders that I will go over next in this PowerPoint presentation: BN, AN, and EDNOS. So anorexia nervosa is categorized by restricted eating, weight loss, and anxiety of putting on weight. These individuals tend to wear baggy clothes, and during meal times they tend to skip them, pick at them, or blot at them with paper towels. The first step in treating anorexia nervosa is to maintain a healthy weight. Once that is accomplished, the next step is to begin a healthier relationship with food. Bulimia is categorized by periods of binge eating bad foods and then compensating by overexercising or vomiting, and other times having long periods of extreme restrictive dieting patterns. And a study in 2007 stated that binging can significantly decrease with guided self care therapy. And I will go over what self care therapy practices can be later in the PowerPoint. The last type of eating disorder is called eating disorder not otherwise specified. It is when an individual does not meet the diagnostic criteria for AN or BN, but they still put a lot of stress on dieting and restrictive eating patterns. EDNOS is also an umbrella term for pica, night eating syndrome, bigorexia, and Prader-Willi syndrome. And this type of eating disorder is unfortunately not usually covered by insurance companies. I also want to touch on boys and eating disorders in the adolescent period or in the young adult period, because a lot of times it's always focused on girls. Um, the type of eating disorder that is most common in boys is EDNOS, and they're closer to the bulimic part, but they usually don't use laxative or vomiting. They tend to do just a lot of excessive exercising. And what doctors and registered dietitians look for and are worried about most in boys with eating disorders is bone mineral density loss. And the National Eating Disorder Association stated that mortality rates are higher in boys with eating disorders than girls in the eating disorder population. And a lot of places have stated that they have an higher increase in the rate of recovery and remission if the treatment team for that male individual is an all-male treatment team, like the registered dietitian, the medical professional, and the exercise physiologist. And also, boys do have the same troubles in schools as do the girls that I stated before. So, a lot of times, comorbidities can rise in adolescents with eating disorders as well as adults with eating disorders, such as depression, personality disorders, obsessive compulsive disorder, and anxiety. And it is extremely important to treat these alongside and at the same time as the eating disorder. It has been shown if they are not treated at the same time or during the eating disorder to severely interfere with the treatment of the eating disorder of the individual. Eating disorders, especially developing during the adolescent period of life, can have a long-term effect, such as osteoporosis, infertility, stunted growth, and negative feeling towards food for years to come. So the lifelong effects that are more specific are damage inside the body and body complications. The children can have brain damage, bone damage, and muscle deterioration. The bone damage specifically is bone mineral density complications, and teeth. So if one is binging, the stomach acid is going to come up through their esophagus and hit their teeth while coming out of the body through their mouth, and it can lead to the teeth falling out very early in life or having a lot of dental problems because the stomach acid is hitting the teeth and wearing them away very fast. So individuals can eventually have very bad cardiovascular complications such as electrolyte imbalances, blood pressure abnormalities, kidney failure, and many other things. And they can have GI distress problems such as heartburn, diarrhea, constipation, and indigestion. So these are the type of treatments I'll go over today. Nutrition counseling, inpatient facilities, outpatient care, medications, and CBT. Usually we find CBT in the adolescent eating disorder population in the family therapy settings. The focus of CBT is to look at the negative feelings towards food and the negative thoughts that trigger the patterns of an eating disorder in the patient. CBT can help finding more positive ways to cope with an eating disorder as well as the comorbidities. And a study stated that studies have shown positive results with remission in 30 to 40% of patients. Inpatient treatment is usually only seen if the patient has very low body weight, dehydration, electrolyte imbalances, cardiac arrhythmia, substance abuse, and if they have medical issues that are interfering with everyday life and the treatment of the eating disorder that they need to figure out and treat first. These are typically more cost effective than having multiple hospital stays for those things that I stated above. And inpatient care facilities are usually 24-hour facilities with all the professionals and treatment needs that the patient will need. Medications aren't usually seen in adolescents with eating disorders. Sometimes SSRIs can be used. They are a type of antidepressant medication. They are SSRIs stand for selective serotonin reuptake inhibitors, specifically fluoxetine, if that's how you say it. And a study in 2007 stated that children and adolescents may be more responsive to SSRIs because the parents would ensure compliance with the medication use. Outpatient therapy is a very large umbrella term for different types of therapies, such as nutrition counseling, psychotherapy, yoga, group therapy. It is very non-restrictive, and the patient can decide to see one or multiple individuals as many times or as little amount of times in the week as they want. And a lot of times this can be used after inpatient therapy care has ended. So the role of an RD is extremely important in any age group with an individual. They can explore the patient's current dietary intake, their nutritional needs, making meal plans, determining the weight goal, and exploring fears and emotions towards food in the patient. They are not only there for the patient, but they're also there for the family of the patient. And they are there to help work through myths and misconceptions about food and weight. And I want to quick touch on technology in adolescent eating disorders and in RD. Um, Technology is very influential in a positive and negative way in an adolescent's life. Examples of this are text messaging, YouTube, podcasts, Twitter, Pinterest, Instagram, anything. And an RD can help convey nutritional information in a very appealing way to the young patient. They can become they can have a very good relationship if they are on terms of technology between the two of them. This is the appendix that I used at the end of my paper. I titled it Counseling in Adolescent Eating Disorders. It can be used by the registered dietitian or family and friends of a patient with a diagnosed or undiagnosed eating disorder. They're very quick tips, the do's and don'ts of wanting to talk to someone about the potential eating disorder that they might have. And these tips can help make the patient more at peace during a session and feel very comfortable during it and not very forced or being judged or playing the blame and shame game. These are my references. There are more in paper.